So why should we care if a child is not growing as expected? Well, there are two broad reasons. The first of which is the concern of missing an underlying health condition or disease that may explain it. And of course, we'll talk about that in the latter part of this talk. But the second is that malnutrition is associated with several negative health consequences, regardless of the etiology. So, for example, deficiencies of individual vitamins and minerals can each have negative consequences on overall health. Another well-known consequence of malnutrition is muscle dysfunction, which can objectively be measured as hand grip strength, but unfortunately its use in pediatrics is limited and therefore is not feasible, particularly in the youngest patients. In pediatrics, the loss of lean body mass and muscle weakness is more likely, however, to translate as gross motor or fine motor delays. And there have been several studies that have demonstrated a negative impact on all aspects of development, either in association with failure to thrive or with association with the individual micronutrient deficiencies such as thiamine or iron. There are lots of reasons for infections and immune dysfunction, several of which include lack of macronutrients and factors that may modulate immune maturation and or the response to inflammation, and lack of micronutrients like selenium and iron and zinc that have a role to play in immune function. It has also been associated with delayed wound healing and prolonged hospitalizations, and there's also a concern that persistent malnutrition can also lead to long-term reductions in height and weight, as we've alluded to already, with stunting being a concern of chronic malnutrition and low weight being a result of both acute and or chronic malnutrition. Several studies have examined the effects of failure to thrive on long-term development. In terms of cognitive development, there have been a couple of meta-analyses, the first of which there showed a weighted difference in IQ of about 4.2 points, which was considered to be sufficiently large enough to be of importance at a population level. In these meta-analyses, inclusion criteria was that failure to thrive had to be diagnosed in a primary care setting. The second study showed an IQ difference of only 3 and was of questionable clinical significance. However, they included all patients with a weight less than 10th percentile or weight velocity less than 10th percentile as defined as failure to thrive, which of course, as we've alluded to, is not the standard definition. So this inclusion of those with the weight or weight velocity between the 3rd and 10th percentile may have affected the results. In individual studies, several researchers have also studied infants and toddlers with failure to thrive for up to 11 years and have shown deficits in learning in IQ, but also learning difficulties and behavioral difficulties. In one such study of 5 to 11-year-old Barbadian children who suffered moderate to severe protein energy malnutrition in the first year of life, they noticed increased attention deficits, reduced social skills, and emotional instability. And these findings were actually found to be independent of IQ or socioeconomic status. Another study, however, only followed 89 infants with failure to thrive up to 12 years of age, and compared to the control group, reported no difference in anxiety, depression, self-esteem, or satisfaction with body shape. So although many children with failure to thrive in early life do eventually have normal function, the take-home message is that the overall trend and the studies are worrisome for long-term adverse effects on cognition, learning, emotion, and behavior. It's currently impossible to determine who will have the later difficulties, but the data does suggest that those with evidence of malnutrition, or when more stringent definitions of failure to thrive are applied, these groups tend to be at higher risk. Therefore, identifying malnutrition remains the most important factor here, and can result in early interventions that may be necessary to optimize growth and development. So, the next question will segue into the consequences of more severe malnutrition. So pause for a moment in the screencast if you'd like and consider this. But I will move on and show you that the answer is that children with edematous malnutrition are at increased risk for mortality. So historically, most severe malnutrition was classified as either marasmus or kwashiorkor, and they're both considered distinct entities. We used to think of marasmus as being due to severe depletion of either energy or combined protein energy deficits, whereas kwashiorkor was mainly thought to be due to protein intake insufficiency. But we now think of them as two main clinical syndromes of combined protein energy malnutrition, each with distinct clinical and metabolic features, but also some overlapping features. The key distinction between the two, though, is the presence or absence of edema. And when we think about what we used to call marasmus or non-edematous malnutrition, it is characterized by depletion of fat stores and muscle wasting. And as the fat disappears, skin loses its turgor and becomes wrinkled and loose. The abdomen can either be distended or flat with readily visible intestinal pattern. There may be muscle atrophy and hypotonia as well. Also noted is xerosis or dry skin. Hair is generally normal but can be affected. Patients with non-edematous malnutrition are usually active and alert but may be irritable and or apathetic. And infections are frequent, often with minimal external signs. So we're going to go through a few pictures to demonstrate some features of severe malnutrition. Here first starting with non-edematous malnutrition. But in either you can see muscle wasting or fat loss. It is obviously more prominent when you have lack of edema. So muscle wasting generally starts in the axilla and groin and progresses to the thigh and buttocks, then involving the chest and abdomen, and later the facial muscles, which are metabolically less active. So that is noted as a late finding. So areas to focus on in this picture that would demonstrate muscle wasting include the clavicles, which are protruding and prominent. You can't quite see the shoulders, but muscle wasting in this region is often noted to be a squaring of the shoulder with prominent acromion and bones in that region. And in the groin, you can see depression in the region of the thigh due to muscle wasting. When you're looking for fat loss here, you can look in the thoracic area where there's depression between the ribs, but also an important place to look at it is in the arms. And you can actually see some wrinkling of the skin already just above the examiner's finger here. One other way to look for this would be to have to bend the arm at the elbow and then roll skin between the two fingers. And you can note that there's very little space between the folds of the skin, and your fingers may touch when this happens. So in this other picture, you can see muscle wasting in the scapula with a prominent scapula with depressions in the regions of the super and infraspinatus muscles. And you can see a lack of muscle definition in the calf area. It looks flat. And then you can also look for fat wasting, particularly in the buttocks where the bony parts are prominent and loose skin folds are noted over the posterior leg. Here is just another example of subcutaneous fat wasting over the buttocks, which becomes wrinkled in appearance and loose as the subcutaneous fat disappears, and the bony parts of the buttocks can become more prominent. You can also see muscle loss in this picture over the posterior legs. So now we're going to move on to edematous malnutrition, formerly referred to as kwashiorkor. Just again a reminder that the WHO definition of severe malnutrition is now divided into edematous and non-edematous based on the presence of bilateral pitting edema, which is of nutritional origin. And this is important because edema is considered a more severe phenotype with a strong association with mortality. Edema does tend to develop early when this occurs and can mask a failure to gain weight, and it usually progresses and develops early in internal organs before you see it in the face and limbs, and when it's present there, it may mask the reduction in fat and muscle that may occur. The mechanisms for edema remain elusive. Theories do center around a low serum albumin, which may be related to increased cortisol and or an impaired hormonal response to stress. It may also be associated with inability to activate ADH due to structural or functional changes in the liver. It may be associated with oxidative stress, And there's also a gut microbiota dysbiosis theory, with a greater diversity in microbiota noted in edematous malnutrition. Abdominal distension may be due to ascites or hepatosplenomegaly. Dermatosis can be variable and often is described as progressing from dry atrophic skin with hyperkeratosis and hyperpigmentation to flaky paint, or also known as crazy paving xerosis, from skin that will split when stretched or result in erosions, with an underlying paler erythematous skin that is noted. Other things that have been described include shiny, varnished-looking skin, dark red pigmented macules, and hypopigmentation of hair. And similar to non-edematous malnutrition, there are frequent infections, and patients are more likely to be apathetic or lethargic, but this is not necessarily a distinguishing feature. So these are some pictures to show evidence of edematous malnutrition. So you can see here pitting edema over the dorsum of the foot. And as mentioned, this may indicate hypoproteinemia, but would also check for other reasons for this, obviously, before assuming it is due to malnutrition, including liver disease, kidney disease, and possibly congestive heart failure. In this picture, you can see evidence of edema. You also note abdominal distension. As mentioned, this can be due to ascites and or hepatomegaly. The hepatomegaly occurs because of fatty liver, which is due to lack of apolipoproteins, which have a role in transporting lipids from the liver to tissues throughout the body. And the hair may be hypopigmented, or in this case, sparse, brittle, and dry in appearance.